There are many challenges that we face as therapists. Time, we never have enough time, right? Productivity requirements, documentation requirements, evaluation of function. The patient cannot take the equipment home with them. No, but they can't take us home with them either. So we really need to find ways to maximize efficiency, and especially in the COVID environment. How can we do more with less of us? And the equipment is our solution. And my hope is that by the end of today, you'll have a different perspective on how we can use it for doing our evaluations. And then we need to be planning for the next level of care, plus or minus equipment. So let's think now about our evaluation. Our eval begins with that consult, right? As soon as we see that order, that consult, that referral, we see a diagnosis. We see the unit the patient is on. We see their height, their weight, hopefully. We see their precautions, hopefully. We're already getting a mental picture of what that patient might look like. And then we go to our chart review, and that fills in a little bit more detail. Comorbidities, past medical history, previous admissions, body mass index, some of the other health-related things, special tests they have done. We start to screen out in our heads what might be going on, and with all this time, we are eliminating and narrowing down our focus, right? We want to plan for safe patient handling tools just as we would canes, crutches, walkers, anything like that. If I was asked to go see a patient on the ortho unit who had a fractured ankle, fell last night, ORIF, they came in today, they're 22 years old, I got to teach them how to use crutches, do some gait re-ed so they can go home. I'm not going to go up to their room without a set of crutches. I know I'm going to need those. So my challenge here is think of the safe patient handling tools the same way. Now I also want to talk just briefly about billing codes. Now we have to grade them low, moderate, or high complexity. And whether we decide a 97161, 97162, or an OT, a 66 or a 67, we're going to grade those exactly the same when we use equipment as if we do it manually. I just put this on here, the factors to consider, because obviously the complexity includes patient history, comorbidities, the depth and results of examination, special tests. There you see standardized tests and measures. We've got the clinical presentation and also our clinical decision making. We can put all of those things in just the same when we do things with equipment as we can with manual. We go in, we're going to start our evaluation. Obviously, for an acute care, we're going to look at SpO2, we're going to look at heart rate, we're going to look at vital signs. There are going to be some things today I will skip over because I want to go through the principles, and we're not going to see every evaluation of every single patient. But we go into the room. I've got my tools ready, right? I've got my walker. I've got my gait belt, which is what I would traditionally use. I now also have an ambulation harness, and I've got my O2 sat monitor. Hi, Tim, how are you doing?
Good, how you going?
Good. Now you'll also see, I'll try to face the camera so that you see me and the patient. I might be this way if I were with a real patient. Tim, we're going to try and get you up today. I'm Margaret, I'm your physical therapist. All right? How are you doing?
Good.
Good. Any pain?
Nope.
Any difficulty? All right. And we're not going to get into specific diagnosis here. We're really going to just look at more of a general type of evaluation. All right, Tim, can you tell me the date today? 8. Do you know where you are?
In the hospital.
Do you know why?
I fell.
All right, good. Tell me who the president is.
Joe Biden.
All right, so we're doing our orientation. Tim, I'm also going to give you 3 words, and I'm going to ask you these in about 15 minutes or so, and I want to see if you can remember them. Elephant, cat, clock.
Okay.
All right?
Elephant, cat, clock.
Elephant, cat, clock. All right, Tim, how are you doing today? I've gone through all the bed stuff. I'm going to have you try and sit up. Can you go ahead and try and sit up? And now he's not able to do it. So what do I do as a therapist? I want to see how much help he needs. All right, Tim, come on over. Come on over. Can you help me? Can you help? I've already made my determination whether it's min, mod, or max. Just in that little bit of range. I don't need to max him all the way up. and then grab him here and hold him to know that he's max assist or total assist. I can make that assessment very quickly. I know that he is going to need help, and I've got a fair idea that he's going to need some help standing up. I don't know how much yet. I'm going to just put this on in supine, and I'm going to show you how I bill for every single second of it. We're going to put it under your back. Are you able to roll away for me a little bit? Okay, so he's rolling. Tell me when you feel it.
Yeah.
We've already done a sensory test where we're asking to feel it. It's underneath him. I'm going to ask him, Tim, can you reach behind you and pull that harness out on that side of you? Watch what he does. He's doing a bridge on this side, a hemi-bridge. He's reaching his arm behind him to try and pull that out. I'm evaluating functional strength and range of motion of his upper extremity. I'm evaluating his ability to follow directions. I'm evaluating his sequencing. Obviously, I'm talking to you, but in my eval, I would be just watching this and going one thing to the next. Can you feed your arms through here? And what about the same on the other side? Can you find that purple strap? There's buckles on the front of that tin. Can you find them? There's 3 buckles. Okay. Can you find them? Now, what he's doing, he's approximating those parachute buckles. He's using fine motor. I'm looking to see, can he match them up? I told him there were 3. Does he get all 3? It's always going to be my job to go back and check that they are tight. But this is all evaluation. This is a functional dressing simulation, right? And at the same time, he is engaged in doing it, so it's all part of my therapy. Are you able to grab this underneath your leg? Okay. You can put the head up if you want to. Can you reach that button? So I make the patient do as much as I possibly can. If they can reach over and hit the button to get up and down, I make them do it. It's working endurance, it's working their range of motion. I'm not going to do it today, but I'm going to use often pulse ox at the same time, especially if I'm in acute care, because I want to see what's going on with their saturation, their heart rate, things like that. Okay, I want you to feed that through this loop here. Can you feed that clip? Good. And can you grab one of these things right here? I'm showing him on the left. I'm asking him, can he repeat that on the right? I'm testing his memory. I'm testing his right-left, his kinesthesia. And can he replicate something I just did on the left on the right? If he's total, then I'm probably not going to use this tool. And this is a tilt bed that can stand him up, or I might use a full body sling to get him to the side of the bed. If he is total or max assist, the harness is on. I may or may not use it, but it's there if I need it. So I'm going to grab the ceiling lift. They need help to sit up over the side of the bed. They cannot sit by themselves. I'm going to put on the sling in supine. If they can sit up by themselves, I'm going to put it on in sitting. If they can stand up by themselves, but I want to work on higher level gait, I might put it on in standing. But again, this is how I use those mobility levels to help determine the most appropriate way to put it on. For speed's sake today, I'm just going to use the ceiling lift. But you can do the same thing with your floor-based lift. You do not have to use a ceiling lift. I have preference of ceiling lift over floor-based for just the fact that I don't have to manage the lift. But if you don't have ceiling lifts, you can still do it. Can you find that purple strap for me? And can you put it right onto that hanger bar? Beautiful. Now I'm going to make sure it's in. Can you do the same on this side? And at this point, I'm going to ask him if he can sit up and around. He's got the head of the bed up a little bit. I want to know, can he initiate a half supine to sit from maybe 30 degrees head of bed elevation? I can measure it and I can use that as a progression marker. The other thing I can use is a friction reducing device. Sometimes what stops that patient being independent is their butt sitting in the hole in their beds, right? They kind of get stuck in it. I'm going to use a friction reducing device to help them. Can you help me? Can you lift your bottom up? There you go. Back, forward. Pull that out the other side from me, Tim. It's underneath the green. It's underneath this one. So again, I'm going to have him pull it out the other side because this is all part of him being involved. I want you to try and sit up now. Okay, swing those legs around, Tim. Good. Now, don't hang out in this. I want you to try and do it by yourself. Just because this is here doesn't mean you use it. There's slack on these lines. So I can still evaluate whether Tim did that by himself or whether the harness was doing the work. Once he's up here, is anything pinching you, especially in the male parts? I always ask, especially men, can you feel it pinching? With spinal cord injury patients, sensory loss, we have to be a little bit more careful. We're going to just check out their sitting balance a little bit, Tim. Once he's up there, I can push him and check anything I want, right? You go ahead and fall backwards. That's as far as it's going to go. Tim, what happened? Come on, get back forward again. We want you forward here, okay? Try and hold it, hold it, hold it, hold it. Can you reach over here for me? Reach, reach, come on, reach, come on, reach. Right, so I can start pushing him really to the edge of his box. I don't have to worry about being right here and ending up here if he falls backwards, because I've got the sling in place to do that, but I don't have to use it just because I have it there. We've looked at sitting balance, we've checked his strength. Let's see if he can put his socks on. Can you go ahead and put those on for me, Tim? Traditionally, if he is unable to do that because he falls forward, right, I'm not going to even try and have him do that because I'm too worried about him falling forward. But this is going to stop him. And I can decide whether to give more support, less support, depending on what he can do. And here's the beautiful thing about our differential diagnosis. If he's not able to put a sock on in sitting, if his balance in sitting is poor, I don't know whether his difficulty putting his socks on is because he cannot sequence, whether it's because he doesn't have the strength in his leg, whether it's because he has a sensory deficit and he doesn't know where his foot is, or a spatial deficit in terms of where his foot is in relation to his hand. Does he have fine motor and sock manipulation challenges? I can now really tease out what's going on with that patient. So go ahead, Tim, don't worry about this. I want you to try and keep your balance, but put your socks on. Okay, now he's not really, I'm checking to see, is he leaning on these straps? Is he independently putting his socks on, or is he min, mod, or max? How would you rate that? A lot of patients that I would want to try and do this with in acute care, even in ICU, but we don't dare because we're worried about him falling. In this, I can give him more or less support so that he's safe. How much lifting am I doing? None. Is it pulling you back? Can you not get that far? So this is something that takes some time to get used to. It's giving the patient enough freedom to do the task. Now that Tim is at the edge of the bed, we're going to try and stand. And I've got the harness if I need it, but remember, don't use it unless I need it. We're going to put these pants on, but we have to stand up to do that. We've already tested his strength in his legs. So go ahead and stand up. Now, if he is having difficulty, go ahead and sit down again. I may still be here. I'm not a hands-off therapist just because I'm using equipment. So go ahead, Tim, and come forward, come forward. I'm assessing here whether he's min, mod, or max, but I've got the lift to back me up. If he's min or if he's mod, I've done my evaluation as soon as I feel that. And then I've got that hand pendant, and I'm like, okay, I know what he is. I'm going to raise him up with the pendant here. So I'm looking at balance. Now, right now, there's something on here. So as you're thinking about this, we don't know if he's min, mod, max, because this is intention. How can I fix that? How can I know? I'm going to loosen this up a little bit. Go ahead and untie those and tie them back up again for me, Tim. His balance is good. He's independent. If he's losing balance here, go ahead and lose your balance. Oh, that didn't go so well. Can you fix it, Tim? Can you fix it? What happened? What happened? You fell. Can you try and do that without falling? He's safe. I can allow him to make the mistake. And that way, I still know it's not a problem with buttoning or tying his tie. His problem is balancing. Even if his legs are weak, I can give him support here, right? I can even offload him a little. I could take him all the way up. His feet are all the way off the floor, right? He probably doesn't want to hang out there very long. But we can use this to train people to be partial weight bearing, to be toe touch weight bearing, to be non-weight bearing on that side. I may still use my walker, but I'm going to look a little bit more at balance first. So I've done ABL, I've done higher level things. Hey, do you remember what those three things I told you were back in the bed?
Elephant, cat,
Yeah.
clock.
Beautiful. We're looking at recall, just as we would if it was manual. All right, Tim, we're going to go wash it, brush your teeth at the sink, okay? I'm going to be looking at your walking. What do you think about his stance? Little on the wide side, right? Tim, do you always stand like that? Are your feet wide? He's a typical patient. I don't know what I do. All right, I want to bring your feet closer together. Good. Hold it. Don't let me push you over. Don't let me push you over. I can actually really check his balance. I can look at his gait. Now, I may still be doing some leg advancement. If he's got a hemiparetic limb, I may still be working on that, but I don't have to hold him up. So let's head over to the sink, Tim. All right. I think you can see the sink on the camera. Good. If you fall, right, I can ask him. He's a Superman. Can you fix it? Can you fix it? Right now, he's not falling very far. If I've got a really fearful patient, I'm going to start with them very much supported. As they get better, there's a couple of ways I can make it harder. Sorry, Tim. I can loosen the straps, or I can lower the hanger bar a little bit. So I'm going to have him go over here, and I want him to bend over and get the basin with the toothbrush and the face cloth out of the under sink cupboard. So go ahead, Tim, and bend over. Can you open the cupboard door? Can you reach that basin?
No.
No? All right, let me give you a little bit more freedom here. Can you get it? Good. Now stand up. Watch your head. So again, I'm using the lift just as a safety net. And if he can't get back up, I can power him back up. I'm observing. I'm looking for symmetry. I'm looking for him to show me what he can and cannot do. All right, can you brush your teeth for me, Tim? We're getting visual input from the mirror. Let me just turn this a little bit so you can see it better. Okay, so can he brush his teeth? Now, here's the nice thing about having a harness on. I can now differentially diagnose whether a problem he is having with ADL is because of his standing endurance, his leg strength, or is it an upper extremity endurance, weakness? Is it a sequencing problem? So what I'm going to do here, I'm going to help you. I want you to open the faucet for me. Turn on the faucet, Tim. Good. Hold it. I might be doing upper extremity support, but I don't have to hold him up. And we're going to sit in the chair. All right. So we're going to head over here. And you're going to sit in the chair. And if you fall, whoops, fix it, Tim. Fix it. Don't sit down until you fix it. Do you remember how you sit down? Do you remember how you reach with your hands behind you? Good. Reach, 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 reach. So I'm still having him work just as I would without the lift equipment, but I'm using the lift equipment to do it. And what does it look like if the patient is starting and sitting? Same thing in sitting with a mobility. Can you sit forward for me? He's able to sit forward, but he cannot stretch his feet out. So he's a level 2. He cannot demonstrate the strength in his leg. So I'm going to go with a powered sit to stand. I could use a sealer, but I'm going to go with a different device because this might be what you have. Now, Tim, our goal is to get this across here. Can you lean forward for me? Can you do it without holding on? Come on, you can do it. Push from the chair. Beautiful. Now, Tim, as this comes up, I want you to come up as quickly as you can. Try to beat the machine, okay? But you know what? I don't want your hands up there. Where do I want his hands? On the chair. I want to make it functional. So, Tim, ready? Come on forward. And it might just be that this chair is too deep and it's too low. So we might get to there. Tim, can you stand up from there by yourself? Okay, good. All right, well, let's bring this up again. So the problem was initiation from that low chair height. In this position, just loosen this a bit more. Go ahead and just lean back. Let your knees buckle, Tim. Let your knees come forward. Are you symmetrical?
No.
Do you feel like you're in the middle?
No.
Make yourself get in the middle, Tim. Get yourself to the middle. Come on, not with your hands, with your body. With your body. Can you hold it there? Can you hold it there? So again, you can use this stuff in all kinds of different ways. And I'm evaluating, can he determine where midline is? Right? Maybe the nurses have just had him on the commode. Now you'll see here what I wanted to do was have him push with his hands. I don't want him holding on here and just allowing it to bring him up. We want him to be active as he's doing that. So in this position, say he's been on that commode. Actually, let's stand you all the way up. We've got a few minutes left to do this. Okay. I'm going to check his ability to shift weight. So even here, even if he's on the foot plate and he's not doing gait, I can look at his weight shifting. Right? So can you shift weight side to side, Tim? Good. Even in this kind of lift, I'm going to pull him forward so you can see. And check with your manufacturer about doing any of these things. I've already checked with these manufacturers. Then I'm going to lower this a little. And I want to know, can you step this foot down, right off of the foot plate? Good. What about this one? Good. Can you pick this one up again? Pick it up, pick it up. Now, step off the other one. Up, 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 up. Good. I'm starting to look at steps in the equipment. Okay, we're going to the bathroom. His sling is on here. His butt is exposed. He's got shorts on, but he had to pay extra if it was going to be naked. Go ahead and stand up again. If I want to go to the bathroom, I can with this harness on. I can do lower body dressing because this is not covering the perineum. Reach your hands down to the chair, Tim. Reach your hands back. That's okay. Reach your hands back. Find it. Both hands. Find it. Lower yourself down. Lower yourself down. I'm assessing what he can do. Even though I've got the lift, the only difference is instead of me doing the lifting, the lift is doing the lifting. And hopefully you can see that I can really, in some ways, even better evaluate what's going on with my patient when he's in the lift, because I don't have to look. I can turn, I can look at him from here. I can look at him from here. I can cue, I can facilitate. I can see what verbal and tactile cues will do. My email is included here. The references are there for you as well. And thank you for attending today.